in the winter, I get this massive headaches.
Before, I'm having a hard time driving. I don't really drive in the night.
She's a housekeeper, you know, so since she has like a lump on her knee, it was really hard for her to, you know, bend down.
I'm not able to work, and my work is a very physical work. I have to move all my muscles, and the pain just bend myself.
We cannot afford to have the surgery, let alone, you know, have a good eyesight.
I know if I don't do anything about it, it may grow even bigger and it will affect my health.
Economically, I don't have the money to pay for the surgery and do it right away, so I have to wait.
One of the hardest things that we have to do is to tell a patient that they have a bad medical problem and we can't help them.
En ese momento me pasaban muchas cosas por mi cabeza, el no saber qué era lo que tenía, el escuchar de hablar de cáncer, para mí era muy difícil.
It's frustrating. You just have to live with the condition when you can't get any help from anyone.
There's probably misunderstanding, even in the healthcare field, that really today people go without needed healthcare services because they simply don't have access.
I lost my job in 2006, and when I lost my job, they dropped my insurance. So I still don't have insurance because I'm not working, and that's why I didn't have any way to pay for it.
Project Access serves people in our community that wouldn't otherwise have access to health care. It really coordinates the whole system on behalf of the medically underserved. We're like a health plan for the uninsured population.
Project Access San Diego is a remarkable opportunity to provide care for the safety net patient who doesn't have insurance and who doesn't qualify for public insurances.
We're kind of like the last resource. Their community has been looking into other programs that haven't accepted them, and they found Project Access as their last resource for example, for a surgery.
Now, when we talk to these patients who say, you know, you have this bad diagnosis, and I think I might be able to find you some help, even though you don't have insurance, and that's made a big difference for personally in our personal job satisfaction, and it's made a huge difference for these patients that are getting help.
They're so excited when they hear that they're going to receive a service. Sometimes they cry, and all of their family are just very happy to see them go through.
At the individual patient level, of course, you know, these people are getting cured of things that they might have died from or become extremely disabled from.
Recently we helped a young woman who had a brain tumor, and if we didn't have that taken out right away, she would have gone blind.
We have data that shows that Project Access has reduced emergency room visits for our patients. We've reduced the clinic visits that our patients have, freeing up clinic resources for other patients that are in desperate need of care. We know that our patients are getting healthier, that they're getting back to work, that they're receiving services that they would otherwise not have access to. We know that we've saved 3 lives. We've cured a colon cancer. So we're really excited about the outcomes we've had in just a really short period of time.
It's gonna help her out a lot. She's not gonna have that problem anymore, and she's gonna be able to do her regular routine work, #1 thing.
Every time I go an interview, you know, I had in my mind, they're looking at my forehead. Maybe that's one of the reasons I'm not getting a job, because they're worried about this. When I get the job, the employer may think, this is going to increase the insurance premium and all those kind of, so it's going to help. Maybe I will get a job when it's removed.
You know, it's keeping people in work, it's getting parents back to parenting, and it's keeping people out of the emergency rooms, and it's really kind of preventing progression to serious disease that could end up being much more costly later on.
A part of this that I didn't expect was having the opportunity to visit with my specialist colleagues and see how willing every single physician that we have approached is to participate That just warmed my heart.
I've been interested in international aid work for some time, and when I was overseas working, I kind of realized that this would be a cool thing to do at home as well, and there's so much need here in San Diego County that it's a convenient way to be able to give back but not take a big trip to do that.
Project Access actually is able to do something that is very rare in healthcare, and that is we're able to increase access, reduce costs, and improve quality all at the same time.
This is a jewel of an opportunity. It is powerful in helping patients, and it is eminently rewarding.
I feel that the work we're doing is vitally important to the health of our community. I don't think we can be a healthy community unless everybody in our community has access to health care.
I am so grateful this program exists for people who really need the medical attention. Desperate, you know.
From the bottom of my heart, thank you very much.
There are people really who can cry. There are people who are crying somewhere in San Diego or anywhere for medical attention, but they can't get it. So I would say thank you, Project Access, because what you are doing is what anyone of us can never do for themselves.
Yo antes pensaba que nada más era que yo daba. Nunca sentía que recibía, pues no estaba impuesta a eso. Y cuando me encontré con gente que me ayudó, fue como sentirme inútil, como que todo lo tenían que hacer por mí y no me sentía bien. Pero ellos me ayudaron muchísimo, me han ayudado bastante y solamente les puedo decir gracias.